And thanks for joining us. Happy spring. Welcome to the 2025 American Diabetes Association's Living with Diabetes Ask the Expert series. Today's topic is talking about weight management, strategies for empowering conversation with your healthcare team. I'm your host, Susan Weiner. I'm a certified diabetes care and education specialist and a registered dietitian nutritionist, and I'm so happy that you're joining today's event. Our Ask the Expert series is all about you and your questions and what you'd like to know about this topic. So please think about which questions you'd like to ask and start to get them ready. Please stay with us throughout the entire event. Our feedback shows that people who stay throughout the entire event are always grateful to hear other people's questions and the topics that we talk about throughout. At the very end of today's event, we'll have a brief, less than 3-minute survey, which we'd really appreciate you taking so we can receive your feedback. If you're joining today by phone and you'd like to ask a question, please press *3, that's *3 on your keypad, and an operator will collect your question and put you in a queue so that I may call on you to ask your question live. If you'd like me to ask it for you, you could request that as well when your call is screened. If you're participating online, please type your name and question into the fields below the streaming player and press the Submit Question button, and your question will come directly to us. Joining our program today is a great step towards taking care of your health. Thank you to Lily for supporting and sponsoring today's Ask the Expert event, as well as the work of the American Diabetes Association to address obesity. Obesity results from a mixture of environmental, behavioral, and genetic factors, and this means there are multiple ways to manage it. If you'd like to learn more, please visit diabetes.org/obesity. That's diabetes.org/obesity to learn more about it. Now, I'm excited and super delighted to introduce today's incredible guest speaker, Dr. Robin Pashby. And we're so excited that Dr. Pashby has taken the time to join us today. Dr. Pashby is a licensed clinical health psychologist and the founder of Health Psychology Partners, a group health psychology practice that specializes in psychological and behavioral treatment of weight and weight-related chronic health conditions. She serves on the clinical practice committee for the Obesity Society, on the National Board of Directors for the Obesity Action Association, and on the Obesity and Weight Management Advisory Group for the American Diabetes Association. She is also a research assistant professor of psychology at the Uniformed Services University of Health Sciences, F. Edward Hebert School of Medicine. Before founding Health Psychology Partners, Dr. Pashby served as a clinician for the National Institutes of Health funded research projects exploring the prevention and treatment of obesity. She also helped establish and serve as the assistant director and lead psychologist for the National Center for Weight and Wellness in Washington, D.C. Dr. Pashby currently lives in Washington, D.C. with her husband, daughter, and her 2 dogs. Warm welcome. Welcome, Dr. Pashby.
Thank you for having me and for introducing my lovely dogs.
Of course. I'm also a very passionate dog person, of course. So, to jump into today's discussion, we know that diabetes management as well as weight management are both such important topics to discuss with your physician, your certified diabetes care and education specialist, or any member of the healthcare team. It's such an emotional topic. So, it can be very challenging to talk about obesity care, even with your doctor or a trusted member of the healthcare team. How do we make sure that our voices and our concerns are heard when bringing up obesity care and weight management during a healthcare appointment, which we know is already so limited for time?
Right. Well, thanks for that question. And first, I'll just say, I think it's honestly only recently when we have really understood just how sensitive and frightening, quite honestly, these appointments can be. So I think, even just a decade ago, people sort of thought, well, yeah, you go to your doctor to get help. It's that easy. But now we're starting to see just how serious the bias and stigma that has existed around people living with obesity and people living with diabetes and how that affects medical care. So the very idea that we're having this discussion is a huge step in the right direction. I will
I
say the
agree.
first thing is to really remember that having these conversations has the potential to set you on a path toward improving your own health and mental health. But that doesn't mean that they're easy. And I think having some of the strategies that I'm sure we'll get into today will help make that a little bit easier. But just know that these conversations are really, really important to have with trusted healthcare members.
Such a great opening response. Thank you so much for that. It is such a sensitive topic and it hasn't been discussed for years. And recently coming into the forefront of discussions has helped so many people have that discussion with their healthcare providers. If you're just joining us today, welcome to the Ask the Experts Q&A. We're talking about weight management, strategies for an empowering conversation with your healthcare team. And as a reminder, for those of you joining by phone, please press *3. That's *3 on your keypad, and an operator will pick up your question. So you'll have an opportunity to ask it live during today's broadcast. And if you're participating online, please type your name and question in the fields below the streaming player. And remember to hit the submit question button. Your questions will come directly to us. Let's take our first question. We have a number of them coming in, which is excellent. And so this one is coming from Charles, and Charles is calling us from Pennsylvania. Charles, please go ahead with your question.
My question is, I was having trouble with my diabetes, and it was recommended that I take Mounjaro from our doctor. And I've taken it, and I've lost 45 pounds taking the Mounjaro, and I went down to 6.8 on my A1C. And I see all these other medicines, I guess, with the needles and things like that could reduce your weight more. Can you take both?
Thanks for your question, Charles. Because I am a psychologist, I can't speak to specific medicines, but what I can tell you is that given the clinical trial data that I have read, Mounjaro or Zepbound is probably the most effective treatment that we have right now, but there can be combinations. So I would encourage you to, if you feel comfortable, having a conversation with your physician or your healthcare provider and saying, look, this is really helping me, and it's can sort of open my eyes to the fact that there are medications available that might help me. And is there some sort of combination we could try, or is this the best option? Because an educated obesity medicine provider or endocrinologist can walk you through that and can really take some steps to help you figure out what combination of meds or what dosing will work best for you.
And Charles, thank you so much for that question. And Dr. Pashby, so if Charles went to discuss that with his physician who prescribed the medication, which he's done very well on, how does he bring up the topic without feeling bad about it or blamed about it, that his numbers didn't come down more than that? What are some of the strategies we can use to kind of engage in that conversation?
That's a great question. So, Charles, and for anyone else in that same boat, I would say number one is know your facts. So, understand what medication you're on, do some homework on it, and look at what, statistically speaking, is the expected either improvement in diabetes, indicators, or lowering of weight. Like, what's that expected range? And then take your personal data. So, Charles, I think you said you lost 45 pounds or something. Take your personal data and compare it to what we expect so that you go into that physician's office armed with the proper data and information for your situation. Once you do that, you can say something like, let's say you're at the 15% weight loss mark or something like that. You could say, look, I know that Mounjaro has a weight loss range of fill in the blank, 12 to 20% or something like that. And I'm right in the middle of that. And so what I'd like to know is what can help get me to the closer to the 20% weight. Are there things that I can work on from a behavioral side? Are there medication combinations we could try? And so I think the first thing is really to know your data. And that information is widely available online, but also your doctor can talk to you about data. So asking, what is it that I can expect from this medication is a really nice starting point also. What are the outcomes that I can expect, and what can I do to help those outcomes along? So having that sort of conversation, but starting from a know yourself and know your own data place, is going to be a really empowering place to start.
Great advice. And while we're talking about being your own best advocate, when that is possible, how does one prepare for an appointment when you're seeing your healthcare professional where you want to talk about weight management or obesity care and obesity management? Is there something you can do before the appointment to prepare or send ahead of time or bring in notes? Do you have any suggestions around that?
Yeah, I talk to a lot of clients and patients about this because, quite honestly, a lot of times people are afraid to talk to their doctor about it because they don't want the same old advice, which sounds something like, well, just eat less and move more, right? So, a lot of times, again, going in and saying, I would like to have a conversation about weight or weight management, but this conversation is hard for me. So, that just sort of opening the door with the honest starting point that I feel uncomfortable having this conversation
Mhm.
sometimes connects to the healthcare professional on a personal level, right? Everyone has had conversations that make them feel uncomfortable. And if you can sort of get someone out of like, okay, just the numbers in my 3 minutes with you, and just sort of tap into that awareness that, hey, I'm a person and you're a person, that can actually go a long way. So, number one, be prepared to say if you're uncomfortable. Number two, go in prepared with what you have already done to try to manage your diabetes or your weight. Because I think sometimes going in and saying, hey, I know that proper nutrition is important, and here's what I've done. I've worked with a registered dietitian. I, track my food using this app or things like that, can help circumvent some of that sort of rote advice that you might be given if a physician or a nurse or whomever is in a hurry. So go in with a very succinct bulleted list that talks about the things that you are actively doing or have done in the past. Because I mean, anyone on this call, you're empowered enough to be sitting here and taking the time to do this. You're all motivated to improve and manage your health. And so I know that you have done things. And I think it's really important to own that not to get stuck on, oh, well, it hasn't worked, because behavior change is a process, and health and medical situations are a process. So if it helps a little bit but doesn't sort of solve your diabetes numbers or things, that still counts. So a lot of self-talk also, saying that, you know what I have done matters. I still need more help, and I'm going to give my healthcare provider an opportunity to help me, but I'm going to come prepared to help myself too in this conversation. That's sort of a self-talk change, that can make meaningful difference for you.
Absolutely. And going in with an idea of how you want to collaborate with your healthcare team, your physician, your diabetes care and education specialist on the agenda that you want to discuss really helps you to focus during that appointment and is often very appreciated by your healthcare provider. So
Yes,
great
yes.
advice. Great advice. We have a call coming in from Clarence. Clarence is calling from Atlanta. Clarence, please go ahead with your question.
Yes, good afternoon. I'm calling. I am, of course, a sufferer of diabetes, and I'm an older American. I'm having problem with my breakfast. I'm used to breakfast being greasy meat and eggs, and I need to come up with some alternatives that can get me started on a good basis rather than something loaded with fat that I'm so used to. Help me with that.
Mm. Clarence, thank you for your call. I love listening to people at every stage of life trying to make behavior change, but I particularly love it. You said that you're an older gentleman, and I just love that. I love the idea that you can always make change. So I won't give you specific dietary guidance because I'm sure there are people in your life that can help you with that. But what I will tell you is maybe a strategy to think about it a little differently. You said what I'm used to is this high fat meal. I would encourage you to adopt a mindset of, look, I have been around the block, right? I have been through a lot of stuff in my life. And some of it has worked out for me, and some of it hasn't worked out so well. And that's okay. That's part of the learning and growing process. So I'm going to adopt a mindset of willingness to try and try again, new things, because you can always teach an old dog new tricks. We can all learn new things, and really not aiming for perfection, right? You don't need to go from what you said, greasy meat and fried foods in the morning to half a grapefruit, right? You can certainly find some middle ground there and look at portions and other things, but a lot of it has to do with a flexibility thinking, a flexibility mindset that allows you to say, I'm going to try something, and if it doesn't work, that's okay. I'm going to try the next thing and then the next thing, because my guess is, sir, you are someone who has persevered through some hard stuff, and this one is going to be pretty easy on that scale of things that you probably had to cope with.
That's some great advice right there. That's awesome. And as a registered dietitian and nutritionist, I want to remind everybody to see a registered dietitian and nutritionist who may also be a certified diabetes care and education specialist. And you can get a referral through your physician, through your healthcare team, through your local hospital or health network. And often those visits are covered, a number of visits a year, through your insurance. They should be covered through your insurance. And sometimes there are diabetes management classes, diabetes education and self-management support classes that are available too that cover nutrition. So that's a great way to set it off. You will have a lot of information on nutrition, as well as what Dr. Pashby was just discussing, ways to support it, ways to approach it, different ideas for others in your group. So I hope that that's helpful. And also on the American Diabetes Association's website, there is a food hub section, which will give you a lot of great ideas there as well. So really good advice, Dr. Pashby. Thank you so much. We have a great question coming in online that Courtney is asking, and I will read it for her. How should a woman respond when a doctor focuses on her weight instead of the pain, illness, or injury she's suffering while visiting the doctor? So what Courtney is asking is, if she comes in for a sore throat or a pain in her leg or a strained ankle, but the doctor still focuses, or a member of the healthcare team focuses on her weight management, how do we approach that?
Wow, Courtney, you have really tapped into a great question here, and something that I talk to a lot of my patients about. So I would say that there's a range of responses here. On one end of the spectrum, we could talk about finding a new doctor. Now, I recognize that not everyone has, doctors on every street corner, so that may not be possible. But if it is possible to go to a provider who will actually listen to your concerns, that's the number one advice. And know that you deserve that, and that it is okay to do that. On the other end of the spectrum, I have had clients, that I've been working with, literally say things to their physician like, you know, you are commenting on my weight, but I'm here about my sore throat. And I would really like to address the topic that I came in with. So, very directly saying that. Usually people sort of don't want to go to either of those extremes. And so there's lots of middle ground here. The first would be to understand that for the most part, I try to give doctors the benefit of the doubt and know that they're rushed, and that they, at some point in their journey, have really wanted the best for their patients. Assuming that's the case, perhaps a conversation that sounds something like, I understand that my weight is an important factor in my health, and I'm working on that. However, it would be really helpful if we could discuss the pain in my leg, or something like that. So you can sort of acknowledge the fact that weight is an important health marker, because For some people, it is. And that helps the doctor see that, okay, like I addressed the topic that I think is important, but then also call their attention back to the issue at hand, whatever that may be. Now, this gets tricky when weight is seen as connected to the condition that you're there with. So it's kind of obvious in the most simple. I've had a client that went literally for a strep throat test and was handed a pamphlet on bariatric surgery. So those two have nothing to do with one another, and that was a really upsetting, in fact, pretty demoralizing experience for her. On the other hand, sometimes people with orthopedic conditions or other things will say, look, my knees do feel better when I lose a little bit of weight, or I'm building strength in my quadriceps or things. So I'm aware that my weight does play a role in this. And so I think in those cases, when your weight is potentially exacerbating or contributing to the condition at hand, simply saying, I'm aware that my weight is a factor here, but I also have this other condition that really needs your attention. Again, goes into making sure that the doctor understands that he or she has been heard too, so that you kind of aren't just like talking past each other. I have lots more thoughts on that, and it's a really important topic. I would also say, from the psychological side of things, that question you asked is one of the very reasons that people living with weight struggles avoid doctor's appointments.
Absolutely.
It's the reason that they postpone preventive medical care, why they delay medical testing, why they avoid, MRIs and other things, right? All of this built-in bias to our medical system. And so the more armed you are with understanding of how weight bias affects people just like you, like me, and you can get a lot of that through the variety of places that Susan talked about that I'm affiliated with. But the more you are armed with understanding the impact of bias on your own behavior and on the physicians, then you can actually call it out when you see it, right? And so I think, again, going back to what I said in the very beginning of this call, knowing your facts, it's not just your facts about your numbers. It's the facts about how important addressing weight bias is, and joining communities of people. They are out there in many different forms. Communities of people that are advocating against weight bias, that are taking a stand, can really give you that sort of empowerment, like that hand on your back saying, hey, you're not alone in addressing weight bias. And that can go a long way in helping you have some of those hard conversations.
This is such an important conversation and such an excellent response, Dr. Pashby. And I will say that in my experience over the many years that I've been in practice, if you walk in for a strep throat and immediately you're handed a pamphlet for bariatric surgery, you are definitely not going back for your follow-up appointments. Your way of handling that is not to engage in it. So thank you for those excellent strategies and advice, and a way to think about it and advocate for yourself. Very, very important. If you're just joining us a little bit later in the call, we are talking about weight management strategies for empowering conversations with your healthcare team, and we're having a fabulous discussion with excellent questions. And as a quick reminder, if you're joining us by phone and you have a question, please press *3 on your keypad and we'll take your question live. And if you are joining us online, please type your name and your question in the fields below the streaming player. And please remember to hit the submit question button. So let's go to another question here. We have a question from Brenda, which came in online, so I will ask it for her. Do physicians take continuing education courses to address weight management? And if not, would they just tell people from what they're learning in school to eat less and exercise more? Good question.
Brenda, my goodness, please reach out to me so we can have a talk about this later. I kind of not really joke, but one of my most passionate goals outside of my clinical work with my patients is educating physicians on weight bias, and not just physicians, but healthcare providers of all sorts. Because in truth, we all have bias, right? And we have to acknowledge it and we have to work with it and work through it. Now, it's not all about weight, right? People have bias about a lot of different things. But unfortunately, up until pretty recently, there wasn't a lot of education for physicians on weight, obesity, weight management. I actually did my PhD in a medical school, and so I was privy to how little discussion there was about obesity care. Yet, of course, primary care physicians are sort of on the front lines of doing this. So there are more programs now. The Obesity Medicine Association, for example, has an advanced certification where people can become board certified obesity medicine specialists. And so those are the types of providers that have really gone the extra mile to try to get additional training in terms of understanding obesity as a chronic disease and how to help people manage it. But I think for the most part, there isn't a lot of very widely distributed information. And that's why conversations like this and some of the work that the American Diabetes Association is doing and other organizations are doing to help educate healthcare providers, because it's not just physicians, right? It's therapists like myself, it's dietitians, it's diabetes educators. All of us need to understand what is the newest information, because the other thing is, in the last 5 to 10 years, what we know about obesity care and treatment has just exploded, right? The field is not static. So even if a healthcare provider took a continuing education class 5 years ago, they're probably still outdated and they still need to play catch up. So find an obesity medicine provider if that's at all possible in your area, because those are the people that are really staying on top of this work.
Great point. We're going to take another question live from Etta, who is calling from Bronx, New York, just north of where I live on Long Island. Etta, please go ahead with your question.
My question is, I have a family member who's presently in rehab and has gained a lot of weight, and his A1C is 6.6. And I'm calling to see how that could be addressed, and I could be of assistance along with the medical staff, because he sustained a traumatic brain injury in 2017. So
Great question, Etta. Yeah. I think the question is sort of, how do you talk to your family member and also get the buy-in and help from the medical care team that your family member already has available. So
right.
The most important starting point that I would say and do say to anyone is, first and foremost, ask consent. Ask if it's okay with your family member to have a conversation about his or her, their weight. Because as we started this conversation on this call, weight is such a deeply personal struggle for people, and people need to be cognizant of the fact that you're about to talk about something that is very private and can be very shame-invoking for some people. So simply saying, "Hey, would it be okay if we had a conversation about your weight and how I can help?" And that gives the person the opportunity to say, "No, I don't want that." Now, I know that that might not be the answer you want, but also remember that some of these conversations are not one and done. They can happen and unfold over time. So sometimes what happens is, if you respectfully ask consent from your family member to talk about weight and they say, "No, thank you," you may be surprised that a week later, a day later, maybe a month later, they start to feel more open to say, "Hey, I was thinking about that. And I was thinking about my weight is, bothering me, or I'm nervous about it, or I need some help or something." So we have to play the long game here when thinking about supporting people with dealing with weight struggles. Your family members in rehab, I don't know exactly what kind, but my guess is they're already on a pretty arduous journey for them, and adding weight into the mix sometimes can just feel too overwhelming, right? It can feel too big of an issue, or it just feels like, of all the things I'm struggling with, this is the thing that I have to sort of put to the bottom of the list. And we have to respect that people have autonomy in their healthcare and in their healthcare choices. So asking consent is really, really critically important. And remember that Sometimes it's going to take more than one conversation. When you do talk about weight, please do it in a way that isn't when the person is eating or when you're eating, or right when they've gotten on the scale, or when they've just had an embarrassing experience at the hospital or something. So in other words, you don't want to do it at a time that might pique more shame. You want to try to do it at a time when defenses are lower and people are feeling supported. In terms of talking to the medical team, I think, oh, one more thing. Most people dealing with weight struggles understand that they are struggling with their weight.
Yeah.
So you're not giving them new information. So you could simply say, I'm here to help, right? Let me know how I can help you. If that means talking to your doctor, or if that means, driving you to an appointment, I'm willing to do that. If that means going for a walk together after dinner, I'm willing to do that. But remembering that it really has to be driven by that individual person. And when it comes to talking to their healthcare team, encourage the healthcare team as well to be respectful and to also ask consent. Because I'll tell you, there is nothing that opens the door for respectful conversations around weight more than building trust. And we want to build a trusting relationship with this person about this topic so that you have the chance of actually helping later on.
When it's in the heat of the moment and you become accusatory towards a person, or you shouldn't eat that, the same way with diabetes management, if we were just separating that from weight management for a moment, should you be eating that? You have diabetes. In that moment, the blame or the shame that you're putting on someone will completely backfire on what you're trying to do to help, or to help them with education, or to talk to the staff. All of that will backfire if it's at a heated moment, or it's not at a neutral, kind of calm time.
The other thing I'll say, Susan, that you're exactly right, is one way to also do it is to actually listen to what your loved one is saying, because sometimes you can comment on their own negative self-talk about weight. So if you overhear the person you love saying, gosh, I'm so disgusting, or I can't believe I weigh this much, or something, you can actually talk about that and not even address their weight. You can say, boy, I hear you, really, really being hard on yourself about weight. Is there something I could do to help you? Or, boy, it really makes me feel sad to hear you, shaming yourself like that. Is there anything I could do to support you? And sometimes just that takes it away from the eat less, move more mentality, and more to, hey, I know this is a journey and I'm here to support you.
Fantastic way to start a conversation. That's excellent. We have a question coming in from Leonard, who would like me to read the question for him. Where can he find a health psychologist in Western New York? And so this will apply to people calling in from all over the country. Does this doctor do any, they're asking if you do any telephone consultations, because you're doing such a great job today,
Oh,
Dr.
thank you. Thank you.
So I
Um,
think he's asking, how does one find a psychologist to help with a lot of these issues?
Boy, Leonard, this is my other lifetime goal, is to train more psychologists in obesity medicine, because quite honestly, I thought that the physicians didn't get very much training. Psychologists get even less than that. So um, anyone who understands obesity like I do, or like some of the health psychologists do, are there's actually not a huge number of us. That said, health psychologists in general can be found lots of different ways. There's the Society for Health Psychology. There's Psychology Today, and if you can filter that by your zip code, I will say that we have an interjurisdictional compact that psychologists like myself have. And so we are able to do telehealth. I'm licensed in New York through a separate licensing process. But so for anyone listening outside of New York, know that there's access to psychologists not just in your home location now because of this side pact thing, but right now there isn't, sort of, other than the Society for Health Psychology, there isn't like a one spot where you can find health psychologists. And I know that I would love to be part of changing that in the future.
Great. And good luck, Leonard. I hope that you find the psychologist that matches with you. And as Dr. Pashby said before on other topics that we're discussing today, if it's not a good fit when you first find someone, whether it's a dietitian or a physician or a health psychologist, that's not totally on you. You can keep till you find somebody who you click with. It can take a few times. So make sure that
I
you do
always say it's
that.
like shoe shopping. You don't just try on
Oh,
one pair and walk out of the store, you got to make sure it's a good fit. So
absolutely. That's very, very true. We have many more live callers coming in. I'd like to take a call from Anne. Anne is calling us from Washington. Anne, please go ahead with your call.
Thank you, and thank you for having this program. I know what I'm supposed to do to lose weight, but I am very undisciplined, disorganized, unstructured person, and so I often don't stay on target because of that. What can I do to improve myself?
And thank you so much for your question. And I'm betting that you were brave enough to share something that's been on your mind that many other callers and listeners to this podcast, to this webinar, will feel. And so let me make a few adjustments to that for you. Number one, I know what to do, but I just don't do it, is a statement that I hear probably every day, many times a day from my patients. And here's what I say: what is the it that you're talking about? And if you were sitting in my office, I'd pull out my trusty whiteboard and I'd write it across the top. And maybe a good exercise for you to try at home is to do that. Write it and then brainstorm all the things that you think you need to do to lose weight. And I'm guessing it includes things like change my nutrition patterns, reduce my portion size, increase my exercise, get better sleep, manage my stress, take my medications on time, drink more water, go grocery shopping more often, you name it, right? I just spent 10 seconds and I could spend 45 minutes doing that it. And then I want you to step back and look at that and recognize that the it, which seems so simple, is actually a combination of hundreds, maybe more, tiny changes. Some of them are bigger, some of them are smaller, but they are all like, let's say, improve my nutrition is something that people will often say. Okay, well, what does that look like, right? Does it mean managing your diabetes related nutrition, or does it mean trying the Mediterranean diet? Does it mean changing how you cook? Does it mean, right? You see what I'm saying? Break it down into all of these little pieces and then step back and say, oh, boy, this is actually a lot more complicated than it seems like it should be, right? So that's number one, is to recognize that this is actually I sometimes give the example, it's like dumping out pieces of a 500 piece puzzle on the table. And you can look at it and think, boy, I can't wait until that's a picnic basket picture, but you still got to put it together one puzzle piece at a time. So the same is true for managing our weight. So pick something and pick a small something that is part of that bigger it and start there. Number two, don't be a perfectionist. You said something like, I get off track or I don't stay on target. And I sort of joke with my patients that we tell ourselves, like, I need to be on the wagon. And then we fall off the wagon and we spend who knows how long, a week, a month, a year, chasing the wagon to get back on, which assumes that the wagon is the only right way. Well, that's hooey. That doesn't make any sense. Behavior change and weight management is, again, so made up of so many small things. And it's just sort of this evolving process where what works for you at one phase of your life, maybe you're new in your career, maybe you're ending your career in retirement, maybe you have a new family, maybe you're an empty nester, maybe you have no kids or you're single. All of these phases of life are new challenges. And what worked for you back when may not work for you now. So you got to get real about what's going to work for you right now. The other thing I'll say is that I heard a lot of negative self-talk, a lot of labeling yourself, undisciplined, unable to stick to things. Well, my guess is that if you don't have some sort of undiagnosed or diagnosed or not properly managed, maybe executive function challenges or things, which, by the way, many adult women have, but were missed back in the day before we thought that women had it, I guess. I don't know. That's one thing to consider. And then the other is look at other parts of your life where you are able to keep routines or keep schedules, and let's build from that standpoint, right? Let's start talking to yourself as though you are a capable, confident, free spirited woman who wants to manage your weight in your way. And then you figure out what is that big it and what is it going to look like for you in your life, not according to any book or BMI chart, but what is it going to look like for you? What are your goals? Think, what is the most important thing to me, right? And then finally, avoid the perfectionistic idea, right? I think that a lot of times when I'm working with patients, I uncover so many unwritten rules that we have. So if a patient says to me, I know I need to exercise every, whatever, several times a week. I say, okay, well, what rules in your head exist about exercise? And what you might uncover when you start breaking that down is that you might believe that in order for it to count as exercise, it needs to be at least 30 minutes, and it needs to be so intense that you're sweating, and it needs to be that you've changed into exercise clothes, and it needs to be first thing in the morning because that's when the early bird gets the worm, and it needs to be at least 3 to 4 times a week or it doesn't count, and it needs to be in a gym. It can't be, right? All of these sort of arbitrary rules that we've made up about what it means to get more exercise can really be tossed out the window. And you start thinking about what works for you in your life, whether that's dancing around your living room while you vacuum, or going for a walk with your neighbor, or laying on your living room floor and doing some, yoga or Pilates moves, or doing chair yoga at your community center. Those are all options. You don't have to sweat your brains out every time you work out for it to feel good, because doing a lot more to manage your mental health will actually improve your ability to manage your physical health. So when you start thinking about behavior change in terms of what is going to make my mental health feel better, then you are kind of going in the back door of changing your behaviors to help manage your weight too.
And a lot of what I'm taking away from that response, Dr. Pashby, is we used to say, and I still hear it a lot, just one saying, small steps lead to big changes. Okay, that's great, but what does that mean? And your strategies and using the it and the board and not beating yourself up over this, and what might have worked 5 years ago will not work now or may not work as well, is such excellent advice and a lot of positive talk. Look at what you're doing positively in your life right now and also think about that. It's really hard for people living with diabetes and trying to manage weight to feel good about themselves. So those were some fantastic strategies. Thank you so much. I think that was extremely, extremely helpful. Let's take another call. This one is coming from Arlene. Arlene is calling from Pittsburgh. Arlene, please go ahead with your call, with your question.
Yes, Doctor, thank you so much for this segment. My mother was always a string bean, and I was always a chubby. As a result, overweight was almost became a moral issue. And this is in my head. Anytime I see anybody overweight, I go to, something is wrong with them. And here I am, about 50 or 60 pounds overweight. And it's a moral issue. And I'm diabetic, and ironically, my diabetes is under control. But I have a healthy appetite. And how can I mentally stop thinking of this as being bad?
Yeah, Arlene, oh my goodness, you callers are doing great work today. I'm telling you, you're hitting all the high notes. This is awesome. Arlene, first of all, recognizing that your mom who never struggled with weight is the one who gave you that mentality, is step one, right? Because I try to think back about the lessons that our parents taught us, and so many of them are so powerful in good ways. And some of them are antiquated, you know what. So in this case, I'm going to give your mom the benefit of the doubt and say that if she were forming her own ideas about weight today in 2025, maybe she would have a different opinion. Or if she had lived an experience where she struggled with her own weight, maybe she would have had a different opinion. But because she didn't, and we didn't know better in a lot of cases, we did make weight a moral failing, right? If you struggled with weight, it's because you were weak willed or undisciplined and all that other stuff, which is why we heard from the previous caller words like undisciplined just come out of our mouths about ourselves. So the first thing would be, I would say, thank your mom for trying, and then tell her that you disagree. And whether she's living or passed on, you can still have that conversation.
Mm.
I disagree with you, right? I'm choosing to take the science that is available to us today and make my own decisions. I'm a grown woman and I get to choose. Okay. So when you start doing that, you start not sort of taking what your mom gave you and carte blanche taking it with you for your future. You start to make your own choices, and that autonomy can feel very empowering. So that's number one. The second thing is this idea of judging others. I believe that when we judge others, it's a reflection of how we treat ourselves. So when you see someone else living with weight struggles and you think those negative things, it's because you've told yourself the same story about your own situation. And that's your place to start. When you start talking differently to yourself, because we have science that tells us differently, then it gets easier and easier to work on how you're judging others. Because I could hear in your voice, you don't like judging others, right? It doesn't feel good to look at someone else and think negative things about them. Well, imagine how your brain feels when you look in the mirror and think those negative things about yourself. So that's your starting point.
Just excellent advice. And I piggyback to that, please remember to schedule a visit with your healthcare provider to focus on obesity management based on everything we're talking about, everything that Dr. Pashby gave us as suggestions. Have this conversation and help to set realistic weight loss goals. Again, not weight loss goals that maybe came from a metropolitan height weight chart from when you were 20 years old, which is antiquated. Realistic weight loss goals. Learn about treatment options available to you and ask for appropriate referrals, as we talked about, with a registered dietitian, with a nutritionist, physical therapy, and of course, a mental health specialist, just like we had Dr. Pashby having this conversation today with us. It's so very important. Many of you are also writing in questions that I will that I want to address about, can you hear this presentation again because you're getting so much out of it? You can go to diabetes.org/experts, diabetes.org/experts to hear this event, which will be available in a few days. It'll take a few days to get that up, but all past events are on there as well. And Dr. Pashby, are there any other thoughts? I know that you have hours of thoughts on this, but any other takeaways that you'd like to share with our amazing attendees today?
I am so impressed listening to these callers from all over the United States and just thinking, boy, how far we've come. And I'm so grateful to those of you that shared things that can feel hard to talk about. So thank you for that. I guess as a bottom line, I'd like to remind you that you are worthy of respectful and appropriate medical, psychological, and nutrition care and exercise care. And if you are not getting that, then you need to look elsewhere. Okay. Number two, know your own facts. Arm yourself so that you are as empowered as you can be with your own history, your own numbers, and the more you know, the stronger you feel mentally. The next is often these conversations are not one and done, whether it's with a healthcare provider or a loved one, because we're talking about your health. And your health is not something to be fixed. It is a process to be managed over time. I live in Washington, D.C., and the Chesapeake Bay Bridge is about an hour from me. And it's this huge, expansive bridge that crosses the Chesapeake Bay. And I once learned when I first moved to DC that the care of it, I hope this is right, involves painting the bridge. They start at one side and they paint the entire bridge. And it takes so long that by the time they reach the end of the bridge, they have to turn around and start at the beginning because the bridge is so long and intricate. And I sometimes think about that with health and weight. This is a journey, and it is not something that once you reach the end of the bridge, you wash your hands of it and say, okay, I'm done. This is a continual process that we need to manage over time. So there's nothing wrong with you if you find yourself needing to go back to basics, right? And really sort of just think, okay, what are the things that I can do today to help me manage this? And not thinking about what it looks like when you get to the end of that bridge, but just what about today? What are my goals? And when you start doing that, hopefully what that does is start to break down the shame, because shame is just the silent killer in all of this. And it hides in the privacy and the secrecy and the darkness and the aloneness. So the more you talk about it with trusted people, and the more you attend events like this where you say, wait, I'm not the only one thinking these things, the more empowered you feel to take control of your health and your mental health. So thank you so much to everyone who listened today.
Just such fantastic advice. And you've given today not only the great suggestions, and we've opened up these fantastic discussions, but the visuals are incredible. So thank you for that as well. Thank you for that as well. Please remember to talk to your doctors and members of your healthcare team about an obesity-focused visit and options that are available to you. And as I mentioned before, please go to diabetes.org/obesity to find out more information. Please register for our next event at diabetes.org/experts and sign up for diabetes education near you. Call 1-800-DIABETES, which is 1-800-342-2383, or email askada@diabetes.org to request a digital copy of the How to Thrive resource that can help you on your diabetes journey. And we had so many incredible questions today. Obviously didn't get to all of them. There were a ton of them because this topic is so fantastic and Dr. Pashby is such a great expert. We're sorry if we weren't able to get to your questions for this event, but if you have any questions particular to this topic and this event, you're welcome to contact us at askada@diabetes.org. In addition, all of these Ask the Expert events, again, are available on diabetes.org/experts. I really encourage you to please stay on the line. In a few minutes, we will have our very short survey, and please stay tuned for future events that we will be having coming up. In May and in June, we will have our next Ask the Expert events on weight management, treatment, and goals. So we'd love for you to come. Please visit our website for more information at diabetes.org/experts and register today for these incredible events. So let's move on to the survey. And I know that your feedback was amazing during the event. So participating in this survey for this Ask the Expert event can really help us plan for future events. There'll be 6 questions, and we'll start with question 1. This event met my expectations today. Question number 1. This event met my expectations today. For yes, please press 1. For no, please press 2. And if you're unsure, please press 3. Question 1. This event met my expectations today. For yes, please press 1. For no, please press 2. And if you're unsure, please press 3. If you feel you can use more support for managing your diabetes, please check out diabetes.org, the website, navigate around the American Diabetes Association's website for more information on mental health support, food, recipes. There's just so much excellent community support, peer support. There is so much out there. Okay, let's go on to question number 2. Question 2, I will attend another Ask the Expert event. Question number 2, I will attend another Ask the Expert event. For yes, please press 1. For no, please press 2. And if you're unsure, please press 3. Question 2, I will attend another Ask the Expert event. For yes, please press 1. For no, please press 2. And if you're unsure, please press 3. And please remember, if you want, anytime you want more information about obesity management, please visit diabetes.org/obesity. That's diabetes.org/obesity. And again, we will have several more Ask the Experts events on this topic of obesity care management. Moving on to question number 3. Question 3. This event improved my knowledge of how to talk about weight management strategies with my healthcare team. Question 3. This event improved my knowledge of how to talk about weight management strategies with my healthcare team. For yes, please press 1. For no, please press 2. And if you're unsure, please press 3. Did you know that there are approximately 38 million people living with diabetes? So you are not alone. If you're looking for peer support, the ADA for peer support offers peer support through local and state offices, diabetes camps, online forums, and more. So please check out diabetes.org/community. That's diabetes.org/community for more information. Question 4, we only have a couple more questions and really appreciate you taking this survey. Your feedback is everything. Question 4, I intend to use this knowledge that I gained from my or my loved one's next appointment with a healthcare professional. Question 4, I intend to use the knowledge I gained for my or my loved one's next appointment with a healthcare professional. For yes, press 1. For no, press 2. And if you're unsure, press 3. For yes, press 1. If you're unsure, press 2. If no, press 2. And if you're unsure, press 3. Remember to check out knowdiabetesbyheart.org, which is on the website as well, to learn how to take simple and practical steps to reduce your risk of heart attack, heart failure, diabetes, and kidney disease. Question number 5. Before this event, I felt confident talking to a healthcare professional about my or my loved one's weight management with the healthcare team. Question 5. Before this event, I felt confident talking to a healthcare professional about my or my loved one's weight management with the healthcare team. For yes, press 1. For no, press 2. And if you're unsure, press 3. There's so much to talk about regarding your health with living with diabetes, and it can be overwhelming. If you want to learn more about strategies and tools for diabetes burnout and mental health, please visit diabetes.org/health, wellness, mental health. That's diabetes.org/health, wellness, mental health. And our 6th and final question, after this event, I feel confident talking to a healthcare professional about my or my loved one's weight management with the healthcare team. For yes, press 1. For no, press 2. If you're unsure, press 3. For yes, press 1. For no, press 2. If you're unsure, press 3. We sincerely appreciate your time and look forward to seeing you on our next event. Please visit us at diabetes.org/events to learn more. Thank you so much.